Hi, Lake Charles in Southwest Louisiana. This is Mayor Nic Hunter. Today is Monday, July 6th. Since the outset of COVID-19, it has always been my attempt and my philosophy to impart up-to-date information, the most reliable information that I could as a mayor, and to rely on sources that were heavily vetted and sources that we trust. It has never been my intention to incite hysteria, but also we can't avoid the facts. And when we talk about COVID-19 itself, the virus, there are a lot of voices out there. I have had the opportunity to speak with this couple gentlemen that is on this conversation with me today often throughout this pandemic, if not sometimes daily. And these are a couple of gentlemen that are local. They have roots here in this community. They have families here, and they're here every day of the week, not just during a pandemic. And I'll just say this, you know, to be kind of forward with this comment, God help us if we've come to a point in our society where during the middle of a pandemic, if we want to know medical or scientific information, we are trusting a meme on Facebook or what my brother-in-law overheard at the supermarket more than guys like Dr. Tim Haman and Dr. Mac Jordan. And so that's why they're here today. We're going to have a very forward conversation and try to impart the most up-to-date and the most accurate information we can to this community. Gentlemen, thank you for joining me. Let's start out with Dr. Haman. Dr. Haman, introduce yourself. Maybe give us a little bit about your background.
Sure. Thanks, Mayor Hunter. Tim Haman. I am originally from Moss Bluff, grew up there. Did college and medical school both at LSU, and I am board certified internal medicine and infectious disease physician. I did an infectious disease fellowship at LSU Health in New Orleans, and I've been back here in the Lake Charles area since 2012.
And what's your current title with CHRISTUS Ochsner?
I'm the Chief Medical Officer for the Southwest Louisiana Ministry.
All right, thank you, Dr. Hammond. And Dr. Jordan, I know that it might be ad nauseum because I've had a couple conversations with you before, but for those that might not have tuned into those other conversations, the same question to you.
Well, thanks, Mayor, for the opportunity. And I'm Mac Jordan. I'm pulmonary critical care physician by training. I grew up in North Louisiana, did my medical school training and my internal medicine residency and my pulmonary critical care fellowship all in Shreveport. And I've been in the Lake area since 2004. Practiced pulmonary critical care medicine for 27 years, and over the last 4.5 years, I've been the Chief Medical Officer for Lake Charles Memorial Health System.
Thank you, gentlemen, for joining us. And again, I'm not trying to be coy, but I will just say, if there's people out there listening to this and they choose not to believe you two gentlemen, I don't know what more I could do to try and get the accurate and effective information out there. So we're talking to a couple local physicians, a couple local leaders in our medical community. Let's get straight to it, gentlemen. We've seen some increase in numbers. Dr. Hammond, hospitalization rates at CHRISTUS Ochsner, have they risen recently due to COVID-19?
Yes, absolutely. We've had a dramatic increase over about the past 14 days. Our previous high was in mid-April, and we've already surpassed that as of today. So we've got more patients in the hospital here at our facility and in the region as a whole than we did back in April when all this started.
Dr. Jordan, same question for Memorial.
Yes, sir. Our results echo or mirror St. Pat's. We had our original peak back the first week in April, and we too have surpassed it in the last week to 10 days. We've had the highest volume of COVID patients that we've had during this pandemic.
Yeah.
Dr. Jordan, go ahead, Dr. Hammond.
Well, I was going to say, just to give a little bit of reference, the prior peak for Region 5 back in April was 46 patients in the hospital. As of today, we have 91.
Okay, that's some pretty stark numbers. Dr. Jordan, does this cause you concern as a physician, as a citizen here in Southwest Louisiana?
It causes me great concern because I think the last time we visited, Mayor, I said we were well positioned in a good place. And that was, I think, the last part of May. And that was true. And unfortunately, since Memorial Day, we've had a change in our trajectory. We had 0 patients in the hospital May 25th through 29th. And then after Memorial Day, we saw a significant increase in the prevalence in the community. Our testing rate went from less than 2%, and today it's close to 25% positive rate for every test we do. So I'm very, very concerned about this trajectory. Sadly, I saw some correspondence, and again, you got to be careful what you read on the internet, but I heard that we're leading the nation. Lake Charles is leading the nation in positivity rate per capita, and that absolutely, if you're not disturbed now, I'm not sure you ever will be.
Dr. Haman, there's been a lot of conversation about the typical flu season. And as an infectious disease doctor, as a CMO, as a physician, are the hospitalization rates we are seeing right now higher and more concerning to you than a typical flu season?
Yes, absolutely. We do typically see in a normal flu season some hospitalizations, some ventilator usage, and even some deaths. But what we're seeing now, it goes far beyond anything we see in a typical flu season. I mean, I don't know that we've seen 21 patients in the flu in the hospital for flu at the same time during a normal season. So, no, I think this is above and beyond what we would typically see.
Is COVID-19 much more transmissible than the flu?
It certainly does seem to be, based on what studies have been done, that people typically infect up to 3 other people for every one that's infected. I don't know, Mac, if you agree.
I do agree. I think, the reproductive number for the flu is anywhere from 1.3, 1.5, and for the SARS-CoV-2 virus, it approximates 2.5 to maybe 3. We still haven't, we're not through studying it, but absolutely, it's much more infectious.
What about, and Dr. Hammond, I'm going to ask you this question again. What about the people that it's affecting? Is it only elderly people? Is it only people with comorbidities?
Not necessarily. I think in the initial wave that we saw, we did see a lot of older, vulnerable people. I mean, some of our nursing homes were hit very hard. And so we did see a much older population in that initial wave. But the wave that we're seeing now is skewing a lot younger in terms of both case volume and then hospitalizations. We do have younger people, 30s, 40s in the hospital, and we've had some people, below 25 with very severe illness, in fact, in the ICU. So, most people that are younger tend to be more asymptomatic, but it certainly can affect anyone at any age.
Dr. Jordan, any thoughts on that?
No, I agree.
Go ahead, Dr. Jordan. We can still hear you.
Yeah, I'm sorry. I agree. I think early on we thought that this virus was not going to affect the very young, but that's another one of these things we've learned as this has progressed, that we are seeing a lot, not a lot, but significant percentage of people who are very young and needing hospitalization.
So, gentlemen, let's get right to probably one of the most controversial issues out there. And it saddens me that this issue has become so polarized and so political, but it is the topic of mask wearing. And correct me if I'm wrong, but Centers for Disease Control, National Institute of Allergy and Infectious Diseases, U.S. Surgeon General, Louisiana Department of Health, all today suggest mask wearing as one of the most preventative measures we can take to slow this virus. Dr. Tim Hammond, what say you?
I think that that's absolutely correct. I also hate that this is kind of turned into a political football a little bit. I think it's very clear that apart from, physical distancing, staying apart from each other, that masks are one of the most effective ways to prevent the spread, especially in public and in confined spaces. I think it's important that we as a community really look at what we're willing to do to protect each other. I think that it's important to say wearing a mask is not a significant burden to anyone. I mean, we wear them in the hospital all day. I mean, we wear them 10 to 12 hours at a time here. And so I don't think it's asking too much of someone to wear a mask for 20 minutes while you're in a grocery store. I think it puts people at risk. And I think it's, we don't think of anything of following traffic laws, wearing seat belts, holding the door for somebody, but for some reason wearing a mask has turned into some dramatic thing, and I hate that that's happened.
Dr. Mac Jordan, what say you?
I think we've always felt masking was important early on in the hospital. I think part of our understanding of this virus, we emphasized a lot of what CDC advocated primarily with cough etiquette, hand hygiene, sanitization of common touch surfaces, but masking wasn't part of the narrative by the CDC, and it's part of our learning curve. We now know that masking is an effective measure. It needs to be incorporated with physical distancing. We shouldn't use it by itself, but it is a very, very important tool to decrease infections. So I strongly advocate, I can't say how much I advocate using all the measures, but masking is just too easy not to do. There's no risk. And again, I can't think of a reason not to.
Gentlemen, thank you. I'm going to try to summarize some of what we've said because I wanted to keep this conversation condensed. I don't want this to go on forever. But it sounds to me like what I'm hearing is the situation has worsened. Dr. Haman, your figures equate to basically that we have double the hospitalization rates than we had at our previous peak. Is that a fair statement? This is not the flu. It's more transmissible than the flu. And what we are seeing, these hospitalization rates that we're seeing cause much more concern than a typical flu season. Fair statement? And gentlemen, I'm hearing it from the horse's mouth. And I agree with you with masks, that we are in the middle of a pandemic. And even if there were certain organizations that said 3 or 4 months ago, masks might not be the most immediate thing to do, I think it's a good thing that we are correcting those statements. And I think there was also some issues with the supply chain of masks 3 or 4 months ago that have been remedied today. So I agree with you, and I thank you for those bold statements. And I will also say that I encourage people to wear masks. And it is part of the governor's executive order, just as a reminder, that employees of businesses that come in contact with the public should be wearing masks. Gentlemen, I'm going to make a closing statement, but anything else that you just want to say to Southwest Louisiana, to the citizens? Dr. Jordan, let's start with you.
The issue of masking is not a political issue. It's not a control issue. It's a public safety and health issue. It truly will save lives. And so I implore the public to do this because we need it. Our healthcare workers need it. We're getting to the point that we're getting close to being overwhelmed, and we need this part of the team to help us.
Hammond?
I agree with everything Max said. I mean, we are approaching the situation we're seeing in other cities like San Antonio and Houston, where the healthcare system is on the verge of being overwhelmed. I mean, we still have capacity. We're still taking care of both COVID and non-COVID patients, but if this trend continues, we may be in trouble soon.
Understood. And gentlemen, thank you for joining me. I just want to close by saying that, again, our purpose in this conversation is not to incite hysteria, but it is to deliver accurate, up-to-date information from experts in this field. And there are a lot of different components and aspects as a society when we look at something like COVID-19. The medical point of view and the scientific point of view absolutely should be at the forefront. I don't know how, as a society, we can maintain a quarantine mentality for months on end or until a vaccine is found, but I do know this, that if we can take some of these preventative steps and preventative measures and take some of these recommendations today, we can allow our local economy to open up in a safe and cautious manner. I am strongly advocating our citizens not to throw caution to the wind and not to believe that COVID-19 is something that should not be taken seriously. And Dr. Jordan, Dr. Hammond, I appreciate you gentlemen joining me in that message to this community. Thank y'all so much.
Thank you, Mayor.
Thank you.